Antiretrovirals are not Panado. They are not over-the-counter medication. They go from one patient, from a doctor to a patient or a nurse to a patient, following particular policies and standards. But after an encounter with such a doctor, they are not just distributed like food or like water or like vitamins. So that's exactly what I was discussing with the minister.
Yeah, and from that discussion, what's your final analysis around what is required? Because during the press briefing that was held earlier this week, the Deputy Police Commissioner had indicated that the ARVs will indeed be sent down.
Well, I don't know. I don't know how she's going to do that, because who do you send ARVs to, Elvis? As I'm saying, for you to get any medication, especially like ARVs, a doctor ought to have examined you and prescribed them. Under whose name will the ARVs come out? Where will they come out from? What will they be treating? Because we don't know the diagnosis of anybody. But if that person has not been seen by a doctor, has not been examined, is just calling for retrovirals themselves, that will be wrong legally, because you can't just call for any medication without a doctor having examined you or without the doctor having prescribed such a medication.
Yeah. So the state in its case before the court is arguing that the mine workers or the illegal mine workers are not trapped, but they are evading arrest. With that in mind, what is the risk for an HIV positive patient if they do not get their chronic medication?
Well, any patient, not HIV patient, any patient who doesn't get medication will demise. There's no question about that, depending on the state of illness.